Eric Hammer here, registered physiotherapist. Today I'd like to talk to you about a really important exercise for Achilles tendonitis or Achilles type injuries. But before I continue, please hit that subscribe button below so you'll be notified about any new videos I put up here on my channel. So essentially with the Achilles, this is a tendon, so tendons connect muscle to bone. This particular tendon connects from your gastroc muscle or your calf muscle and attaches onto your heel. And when this becomes irritated or inflamed, it can be quite painful when we're walking or when we're doing this sort of heel to toe gait pattern, right? Particularly in the push-off phase, if we're going up and down stairs, and it'll be a very localized pain, again, into the kind of back of the heel region. Now, one of the most important types of exercises that we want to do when there's a tendonitis involved is something called an eccentric contraction. And what this refers to is when we're contracting a muscle that's in a lengthened position. And this actually puts the greatest amount of stress on the insertion point of a tendon, which is really important, particularly in the later stages of a tendonitis. The reason for that is in a lot of cases, tendons will develop sort of scar tissue. And as a result of that, they'll be less pliable, and so it'll be it'll be much more sensitive then when we're actually putting a pull right on the tendon. So in this case, when you're walking, there's going to be a greater sensitivity to this push-off phase, so to speak, basically when you're going up onto your heels in your gait pattern. So the way that this exercise works, it's essentially called an eccentric contraction of doing a heel raise. So normally what I'll have patients do, depending on the stages that they're at in their recovery, as I mentioned, this might be more of a medium or intermediate rehab stage to a later stage. I would start the patient on both feet, and they're going to go up onto their toes and then slowly go down, right? So you're up fast, down nice and slow. If the patient can tolerate that, and usually we're looking at their discomfort level being no higher than a 3 out of 10 in terms of pain, then I would progress them to a single leg heel raise, right? So then in this case, let's say my affected side's on my right side, I'm gonna go up fast on my toe, down nice and slow, right? And they might have to hold on to something when they're doing this, right? So up fast, down slow. And then the final progression from that would be to actually go beyond the point of a neutral position with your foot. So what I mean by that is you'll have to go up onto a step, and you're going to again go up fast and down nice and slow, and you're going to go beyond, right, that 90-degree point, so actually past that. And that'll give that tendon again a greater stretch. So again, I'm going up fast, down nice and slow, past that point, past that neutral point, and I still want to stay within, let's say, that 3 out of 10 pain range. Now again, I might also have the patient go with 2 feet initially, right, when they're on their steps, and then progress to a single leg, and then finally to adding in some weight. So that might look like somebody wearing a knapsack with some books in it, perhaps, with a, again, double and then single leg, moving towards the single leg eccentric contraction on the step. Please check with a physiotherapist to make sure that this exercise is appropriate for you. And thanks again for watching. Have a great day. Take care. Bye.